we have to be cognizant that when it comes to research and many mental health activities, you'll find that people with lived experience are not included as would as it would is supposed to be. So these are some of the barriers or obstacles to that inclusion. And like you can see on my screen, stigma and discrimination, devaluing personal and collective experience. And I think one of the major challenges that we have generally in mental health is stigma, because stigma decreases access to care. Stigma is one of those big issues that prevents anything that has to do with mental health to move forward. And research is no different. And there is this misperception of people with lived experience being able to contribute to research because they have a mental health condition. And that is something that is constantly happening. And even if you find people with lived experience, most of the times it's just to tick a box so that it can be seen that this research did include A, B, C, and D people with lived experience. And there's also that perception that people with lived experience cannot be able to make decisions. Therefore, they cannot be able to participate in decision-making processes. They cannot even be able to participate in decision-making that directly affects them. So those are some of the things that now bring out now the stigma, the discrimination, and devaluing that my lived experience can be used to change or make things better, or let people view some of the things that need changing to be viewed differently. And there is obviously paternalism and power imbalances, and that is a major issue. Then the next bit is how to involve people with lived experience meaningfully and authentically. Get. So here we are looking at we need to understand that people with lived experience, whenever they are going to be involved in research, they should be part of the research process, and they should be included at all levels. So if you have to include people with lived experience, and for it to be meaningful and authentic, it has to be people with lived experience have to be included at all levels, and they have to be made, and you have to provide information so that they can be able to make decisions and give feedback at every level of the research process that they are engaged in. And there's this also issue of, lived experience is not a qualification. And this is where it gets very interesting, because we have to understand, and now this I'll borrow from my own personal experience of a few of my mental health conditions. I mean, nobody can understand bipolar the way I understand it, because even if you went to school for it, you don't have bipolar. So you don't have the experience of the highs and lows, and the challenges and all that comes with having a condition like bipolar. So the fact that it is not something that I can go and receive a certificate, a certificate in a university or in a college or in a learning institution, doesn't make my experience less of an experience than any other experience. So these are some of the things. And how do you involve people with lived experience? You also have to be, cognizant of the impact on their mental health and well-being. So there is that challenge, because at times people do not want to provide maybe the necessary accommodations that might make my work with a research team or some research work much easier and much fruitful in the long run. And the last bit is we neglect to adequately budget for lived experience inclusion, devaluing monetary value of lived experience. And I know this happens a lot. The assumption that I will go and share my experiences and I'm just doing it for the good of the community. And like in the African setting, most people will live and say, God has put you through this, so it's a blessing in disguise. So just share with people. And at that time, you're not factoring in that maybe I used my fuel to drive to your location. I used data to have such a meeting, and the essence of that lived experience bit that part, because you cannot get it from a psychiatrist who doesn't have a lived experience. Even if you paint it, even if you do what, you cannot get it. It has to be from someone with that specific lived experience. So the assumption that I'm doing it out of the kindness of my own heart, and it's going to be used in so many big platforms, but in those platforms, you'll find that people have been engaged and they are being compensated fairly. So not considering that cost also to the organization or to the person, the resources that I would need to participate. That means my data, my electricity bill, my fuel, you name it. And not considering the value of expertise and contribution to project outcomes. For example, you're having a research on ADHD, and you need people with ADHD, and you bring me in, but you are not going to consider, or you're not going to put value, any kind of value towards my contribution towards the end outcome of what you're doing. And that is something that is basically very dehumanizing and also very stigmatizing. And we are actually looking at it from when you look at that issue to do with budget and valuing and monetary value, we are looking at it from uh, equal pay for equal work. So it's very important that we recognize and we appreciate that. And for example, for the organization I'm currently working on, we are working on a model that will have like a way to value and to place people with lived experience and how to pay and rate them, just like any other regular consultant that you would have in any team, because that now will start bringing that issue of my experience and my contributions as equally as important as any other person in the team. So